Hello, my name's Emma and I'm one of the midwives at East Surrey Hospital. Congratulations on your pregnancy and thank you for choosing to have your baby with us. The following video is about your place of birth options, whether that be home birth, the birthing unit, delivery suite or theatre. We aim to give you as much information as possible so you can make the right choice for you.
We're part of the home birth team and we're going to talk about how your care will be delivered if you decide to have your baby at home.
If you're planning a home birth, we will usually start seeing you from 28 weeks. We will then follow the same antenatal schedule that you would do on any other care pathway.
Your 31 and 36 week appointments will take place at your home. These visits give us the opportunity to explore your birth preferences further, to discuss any practical arrangements and also to explain the situations where a transfer to hospital may be recommended.
When your labour begins, you will always be supported by 2 senior midwives. One midwife will always be from the core team and the other midwife may be one of the midwives from the hospital who help us with on-calls.
After your birth, we will continue to support you with postnatal care. We'll visit you at home on day 1, day 5 and around day 10. In some situations, we may be able to continue to support you until day 28 if deemed necessary.
Home birth is an option to all women and birthing people. However, if you have any complications in your pregnancy, you may be recommended to have your baby in hospital.
That said, if you wish to continue to explore your birthplace options, we can arrange a personalised care planning meeting with a member of the home birth team or with our consultant midwife, with the aim of safely supporting your choices.
Our goal is to provide safe and holistic care. During your labour, we will monitor quietly and respectfully to ensure safety of you and your baby. If anything changes throughout, we will then communicate that with you and we may recommend transfer.
If you're in established labour and transfer is indicated, we recommend transferring in an emergency ambulance. This enables us to continue to provide care on the way and once you get to the hospital. The latest research shows that places like the UK, where midwives are well connected to the hospital and can transfer people safely if needed, planned home birth can be as safe as hospital birth, especially for people who have had a baby before without any complications. For first-time parents, home birth is also considered a safe option.
Some people choose to have a home birth because they're in their own environment where they feel safe. You can tailor it completely to you, whether you want to have a pool or you want to birth on dry land. You've got access to all your home comforts and you don't have a disruption in that physiological process because the team will come to you. We hope that this has helped you understand a little bit more about the home birth service.
If you have any questions, please ask your community midwife. We're here to support you every step of the way.
Hello, I'm Jo. I'm one of the midwives here on the birthing unit. We have 3 lovely rooms here, all with an ensuite bathroom, a pool, a mat, birthing balls, lots of equipment to facilitate a nice upright birth and make you as comfortable as you can be. Unlike delivery suite, the birthing unit is completely run by midwives, but in the unlikely event that we do need assistance from the doctors, they're just down the corridor. So why choose the birthing unit? The rooms have been specially designed to be a home away from home, to work with your body's natural oxytocin to facilitate a physiological upright birth. The midwives here are really passionate about facilitating your birth preferences and to make sure you have the best birth experience that you can. If you'd like to use the birthing unit, please speak to your midwife. If you're unsure if you can use the birthing unit due to additional risk factors, then we have a team of specialist midwives who can work with you to create an individualised care plan. Our team of midwives here on the Birthing Centre are really excited to see you and we can't wait to meet your baby.
Hello and welcome to East Surrey Labour Ward. This is the delivery suite. My name's Jane. I'm one of the senior midwives on the labour ward. I've been a midwife for about 30 years and still love the job and look forward to looking after you when you're here. This is one of our typical delivery suite rooms. We have 9 rooms altogether and they're all a little bit different but very similar at the same time. There are certain things you'll expect to see in each room, such as a delivery bed, which you don't have to actually be on, monitoring for the baby and for yourself, and there is a resuscitator in case your baby needs any assistance after birth in each room. Hello and welcome to theatre. I'm here with Babek, who's one of our anaesthetists.
Hi, my name is Babak. I'm one of the anaesthetists here at East Surrey. Nice to meet you. We're just having a look around theatre right now, showing you what we've got. So we have our theatre bed behind me, and then we have a resuscitator as well, which is going to be where baby is. There's a lot of people in here, so it can be a bit overwhelming, but they're all here to help. We have an ODP who'll be helping the anaesthetists, and then we'll have the midwives and the theatre support staff, as well as the surgeons, who will all be on the other side. There'll be a little drape covering you, and basically there's one side with the anaesthetist and ODP and the other side with the surgical team. And don't worry about all the sounds, we'll be here all for you, and there's a speaker as well, so you can have a listen to music.
Some of the reasons you may need to be in theatre to have your baby include either an elective, which is a chosen caesarean section, or if we need to do an emergency caesarean section, either before labour or during labour. Also, if we think that you need an instrumental delivery, that is either a ventouse or forceps, then we may well bring you into theatre to do that, because there's a little bit more space and a few more people to help.
Things you might expect from an anaesthetic side are, if you're having a spinal injection, you'll be sat on the bed, or you'll be laid on the bed, and then we'll do the injection, get you laid down, and then it'll be about getting you comfortable and waiting till we're ready to start theatre.
The recovery process, once everything is finished in theatre, you'll be moved to maternity recovery, which is a 3-bedded bay where your blood pressure, pulse, your fluid input and output, and all other measurements will be recorded. We'll help you feed your baby and hopefully get you comfortable before we transfer you to the ward.